This computer. Good evening, everyone. This is Global Research Initiative. My name again is Dr. Okobi Edwards. Well, I usually say board certified before my name. I'm usually the host of this show, and then other people come along to host us. I have a host of other people, Dr. Roots, and other people who are also helping us. Today, we're going to be talking about a topic: how do you survive in residency? And how do you optimize your chances of getting into residency, especially in the US, USMLE? We hold these sessions every now and then, usually every other Sunday, sometimes every Sunday, and we get expert opinion, usually physicians who have experienced the pathway of getting into residency or who share the same path that we share. Today, I have a friend. I call him Bros. He's a big brother to me. For those who know what bros means. And then he's also a mentor, a pathfinder, someone who I looked up to when I was young. I'm still young now anyway, while we were in school. I remember him for being so well kept, very immaculately well dressed, well behaved, always smiling. He's never ruffled. You never see him ruffled, always well dressed. He left Nigeria, came here to the US, and started looking for a pathway to get into residency. Currently, he's a PGY2 going to PGY3 family medicine residency somewhere in Miami. He's done a lot. He's worked in several sectors in the US. He's been there. He's been around and been there trying to get in, but this is his story. Dr. Oswald Ubo, I call him. I'll allow him to say more little bit about himself, and then we'll go into the conversation. The aim of the conversation today is to give you hope and show you where the stones are for those who are in PGY1, where the stones are, what I mean, where the stones are, our own experiences and how it is moving forward, PGY1, PGY2, and tips on how to survive. And it's going to be open mic session. You feel free to stop him at any time and ask any question. And then after he's done with PGY1, he's also going to talk to people who share his experiences about getting into residency in the US. We do this for physicians who are trained outside the US. Even those who are trained in the US also join us so they can understand, how to utilize information to do better. Dr. Oswald, you're muted.
Hello, everyone. Good evening. And I want to thank everyone for joining today. I want to thank Dr. Eddie for creating this platform. I know he said I'm his big brother,
That
but
is not going to change. That is not going to, because I know what you want to say, but that is not going to change. Remember, medicine is
but
evidence based.
he has been a very positive influence in my life. That's true. So today we're just going to be discussing, it's a freestyle. We're going to be, talking about how I got here. So my name is Dr. Oswald Ugbo, originally from Nigeria. We've walked a long journey to be here. Presently, I'm in my PGY2, going to PGY3. Um,
In
so
just 4 weeks, about 4 weeks, it should be in
Yeah, in
PGY3.
about four
About
weeks,
that.
I'll be in my final year. It's been a long journey, but it's
Right.
very doable. It's
Let's start
very
with the
doable.
story. Let's start with your story before you marched. Let's say, what was your perception about, residency, marching? Can I march? Can't I march?
So I'll say this, having graduated in Nigeria and practiced in Nigeria for a long time, I know when people come here, and people would tell you, oh, you're an old graduate, you can't march. Oh, you failed step one, you can, it's not possible. But I know it's like a cliche. People say nothing is impossible. But it's true. Nothing is impossible. Everything is possible.
Yeah,
This is true.
yeah.
Everything is possible. I remember I was speaking to a friend of mine, actually my classmate then, who was already in the United States, already an attending. And she said, Oswald, the only people that will not match are people who did not write the exam.
Yes.
If you did not write the exam, you did not pass the exam, okay, of course, you won't match. But that you finish the exam, you will definitely match. That's the
Just a matter
point.
of time.
Yeah, you can take that to the bank,
Yeah.
you know.
If you
So
persist in the race.
exactly. So you have to be persistent. You have to be continue to improve on yourself. It's very possible. So for me, when I came to the United States, you hear a lot of voices. Some will tell you, just go do something else. But people like me or people like us, then I thought to myself, I'm like, I should go do something else. In my life, one calling only, just one calling, being a doctor. And that's the only thing I'm good at. So when you tell me to go do something else, what other thing am I going to do? An engineer or an entertainer? I can't. This is who I am. So telling me to go do something else is more like telling me not to leave. So I stuck by it. I persisted. It was hard. There's nothing good that is easy. So it was hard. But one thing I did every step, one step at a time, one step at a time. It doesn't matter where you are, basically it just matters that you are taking step, you're taking step, you're taking step. So I did everything, you know. Some doors open and closed. Some roads were not possible any longer, but we just continue. And here I am. I came into this country. I did all sort of job, but every job I did was tied to healthcare. So, and I told the first job I got was working in a nursing home. I told, okay, since I can't be a doctor, but one thing I can do is take care of people. So I'll pass medication, I'll take care of the elderly. I did that. I got into research. We travel here and there. Every opportunity, we try to seize every opportunity. And here I am. So to everyone who has in March, it's very possible.
It's very
And
doable.
there's nothing like red flag. There's nothing like old graduates. If you need it so badly, you get it.
You get it. Let's fast forward to the main topic of today because there's a lot of PGY ones here trying to listen into and trying preparing themselves come July. Some are starting in June. Before residency, before you walk into residency, what should a typical PGY one be doing at this time? What do you, let's say back in your days, what did you think residency was? And then now looking back, what would you have done better, especially around this time, pre-June, July, when they will start? And anybody who's PGY one is free to chime into this conversation.
Yeah, that's a very interesting question, and it's a very good question. What should you be doing as a PGY1 before you get into residency? Before I got into residency, I actually thought that, you want to be a good doctor, you want to be a good intern, you want to know all the stuff, you want to study, you start studying and all of that. That is good, but sitting here now and looking back, what I'll tell the resident is just relax. Don't, no one is expecting you to be perfect. No one is expecting you to know everything. No one is going to be asking you, tell me the classes of renal failure, tell me how to treat acute kidney injury. No one is going to be asking you that. But what you should be doing, it's improving on your communication skills. Most people would think that they have good communication skill. We say it every time, but communication skill, how to play the politics in medicine, how to navigate, uh, as an intern, you're going to have contact with your seniors, you're attending the nurses. You have to be able to develop your interpersonal skills. That is where you survive.
Right. Let's
You
let's
understand?
hammer a little bit on this communication skill because there are various levels of communication skill. I think one of them I know is written communication, how your email should sound, and then verbal communication to your peer, verbal communication to your seniors, and then body language is also another form of communication. Just break it down a little bit as much as you can.
And so let's talk about written communication, for instance. I know, written communications, there are terms you should use when you write, But for us, written communication is not really a big deal. Apart from email, when you have to send an email to your program director, to your attending and all of that. Just, I know we already know that, just being, professionalism in your communication, that is it. Then also your documentation, you have to learn how to document. Okay. It's not really communication per se, but it's a communication in the sense of it because
That people are going to judge you on. Yeah.
they're going to judge you on. So your documentation, it's very important. You don't want to be that intern that writes, shabby notes, because you just want to quickly finish your notes and you just write it. But remember, after you leave that residency program, your notes is going to leave.
After
It's
you.
going to, yeah, your note is going to leave you, really. You understand what I mean? Yeah, and your note is going to go places.
One of the
It's
things I tell interns is if you can, depending on the policy of your program, if you can, incorporate AIs because they help also to check your language, your spelling, especially your emails to your seniors, your emails to
yeah,
keep your emails as short and straight to the point. Nobody has time to read one long paragraph. Everybody's on the move. And keep
that's
it very polite, always polite. Never, never, ever you express emotions in email because they stay. As in like their time signatures, they can pull it up in the next 50 years. It's never going to change. Never ever express emotions on your emails. Keep them as polite. Always have this, build an impression of yourself that people are going to see as this always polite, nice guy. You have 3 years to stay in your residency program. Be that nice guy. Just get out. Right. And then to piggyback on what Dr. Oswald said on documentation, take time before you click submit your notes to read your notes. You will notice that oftentimes when you read your note the second time, you're going to find something, an error or a misspelling or an incomplete information. Don't be that intern who is always in a hurry to click submit because there's something they call submitting. When you're done with your note, you're going to submit it for um, signing or something, depending on the EMR that you're using, right? Just take time to set it and say, let's say someone else is communicating this to me. Have I passed the point? Have I, written what I should write? All right. So that's that for communication. What else should they be doing around this time? And then we'll move into, you know, day one.
so
Some
we talked
programs have
about.
orientation, accommodation, preparing themselves mentally, financially and all that.
Yeah, so we talked about communication. Then I also want to emphasize on interpersonal relationship, and maybe later as we go down the road, we'll talk about why that is important. Then also before you get into you start your first year an intern, you want to make sure that everything is in place. Your accommodation, your finance, everything you need to do to get started. Getting all the access to your EMRO. You don't want to come on the first day you're disorganized, you don't have access to your EMRO. And this is a good time. Like in my program, we do allow interns to come shadow before their first day of resumption. So this is a good time to reach out to some of your seniors and, can I come in and shadow you to kind of just get a feel of the EMR? Because one thing to, if you haven't worked with that EMR, so you want to get you want to get a glance at it before your resumption date. So this is the time. Set your accommodation in place. Set your transportation in place. If you're going to be driving to your hospital or to your rotations, you know set that in place. And if you're going to be taking the train, depending on where you're doing your residency, try it first. See how you can jump from where you are to where you're going, and just have a feel of how the day should look like. So that's what I would say. Yeah.
Amazing. Amazing. This first week of or before I go into first week of residency, there are, other few things that I usually tell people just to add to, what you have said. Um, when you start residency, don't be that resident that's gonna come in your first week or second week with excuses. Oh, my accommodation is not done, like you said, or my nanny is not ready, my child is sick, and all that. Because morning shows the day. Whatever footprint whatever time signature you leave in the first 4 weeks or 6 weeks is usually what follows you all
Exactly.
through, right? So you want to be sure that you're just like you're really ready. Test the water, test everything, see, get accommodations if you're in a busy city, somewhere close. If you're not in a busy city, figure out what you're going to, how you're going to be able to get there on time. I tell everybody in this residency program, in this global research initiative, be that ambassador, right? That's going to make us shine. If everybody's getting there by 7, you heard it when the program director said it the other day, get there by 6. Get there by 6, 6:30. Oswald is almost always the first to come in. Now our sign out is by 5 a.m. By 4, he's there. 4:30, I'm like, bros, how did you even get here before me? You know. All right. PGY one first week. What is usually the typical expectation? What is their typical day like? I know it varies from program to program, but by and large, it's almost the same in almost all the programs
Yeah.
in the US.
Yeah. So for a PGY1 first week, what your seniors and your attending expect of you? Like I tell people, people will ask me, like, and what advice do you have for us? Apart from, discussing like this, having a long talk, the only advice I have for intern is just be responsible. That's it. Just be responsible, you know. So, because the truth of the matter, we know that you don't know, we know that you don't know anything. So, it's not what you read in, what's it called? What's the book for USMLE again? Step one.
Yeah.
It's not what you read. This time around, we're talking about, guidelines. We're talking about guideline. What's the first treatment guideline? What's the second treatment guideline? So we know you don't know, but we just want people that are responsible, willing to learn, humility, well put together, and always dress well. Always dress well. You understand? I remember one of my father-in-the-law, who is no more, said, dress the way you want to be addressed. You know,
Yes.
always dress well. You understand? Always smile. Always be approachable. So on the first week, it's always chaotic, you know, because time will not be your friend. Time will not be your friend. Before you know it, they will tell you, oh, it's attendance round. And you're like, I don't even know my patient. I have not even prepped my charts. I've not gone through my charts, you know. So it's expected, but that's why we talk about these things and giving it, training us how to go about it to make sure that we are put together when that time comes. So you make a lot of mistake, you make a lot of mistake during the first week. And after the first week, second week, at the end of the first inpatient rotation, things will start falling into place. But what I would advise is that be humble, ask for help. Don't just go in and do something. If you are not sure, ask for help. Your seniors, they want to help you. So ask for help, you
There
know.
are a few ways that you've also told me and we've discussed on how to become very efficient using checklists. Uh, Understanding your environment is another thing. I'll just say one or two things about that. Whatever hospital that they posted you or whatever campus or whatever outpatient, ensure you understand these few things. And I'm sure Bros is going to talk more about it. What is the anatomical or the structural environment? Where is surgery ward? Where is the ICU? Where is the elevator? Because not understanding where these things are helps to increase your adrenaline level. When they say go get me the list, you don't even know where the front desk is, where the this is. For big hospitals, it's usually very overwhelming. So take your time, draw like the little map of in your head if you're someone that understands where is the cafeteria, where's the exit, where's the ER, where, all those have a full understanding of the bearing of the hospital. It's usually not easy, but it's something that helps you to have peace of mind to know where you want to go and where you don't want to go. And then understand the hierarchy in the hospital. Who is the program director? Who next do you talk to? Who next don't you talk to? Our lead doctor also want to talk more about is efficiency, both efficiency in its setting, efficiency in understanding workflow, efficiency in understanding how to do a proper documentation. And then we're going to go into presentation and, working with your colleagues and some of the politics that go into place.
So yeah, so like I said, the first week you would have all these things. So that's what we talked about, trying to get into the hospital. Let's say, for instance, if you have that day, you come in before your resumption date. You understand? So remember, you are just shadowing. So you kind of see how the workflow is. You see how the EMR is. You know how if they come in the morning, for every hospital it's a little bit different, but it's still the same principle. You come in the morning, you go through your charts, you know your patient, you pre-chart and all of that. While you're looking through your patient, okay, why is this patient here? This patient was admitted overnight. Why is this patient here? What did they do for the patient? While you're looking at those charts, you kind of see, oh, electrolyte is deranged, and you're able to quickly replace the electrolyte. You know, you know that you are set for success. So you're able to look at your chart. Then you should have a checklist. You should prioritize, You should not be everywhere. There are things that are important, there are things that are not. So you prioritize, you should have a checklist. So while you're previewing those charts, you're saying, okay, I need to follow up on this, I need to follow up on this. It could be that you have a small booklet. It could be that you have flashcard where you write different patient. You write, kind of a brief story. HPI, why is this patient here? What's the diagnosis? What did imaging say? In a short bullet point. Then what do I need to follow up with? Okay, I need to follow up with the labs. An imaging was ordered. It's not out yet, so I need to follow up on it. And as the day go by, you begin to check it. You know. So if you have your plan, you are well organized. So one thing we need to learn is that we should develop the skill of organization. You understand? Come in early, look at your chart, look at your patient, quickly organize your tasks, then go see your patient. Depending on your hospital setting, maybe after you see your patient, then you sign out to your seniors. You quickly see your patient, then you come back, sign out to your seniors. Oh, seniors, I saw this patient. This is what we're expecting.
Let
Because,
let me let me let me let me let me let me interrupt you a little bit there. It's talking about seniors because this is like something that coming into PGY where many people don't have the expectation that they should or most hospitals have you work under a senior. Can you briefly clarify
oh,
that part because it happened to me. I never knew that I should report to a senior or a senior should supervise me or I have to look for somebody I have to present to. I was waiting for the attending. It happened to me in the first day of my residency and it took me like a shocker to, I really had to pull back and say, oh, wow, yeah, I have a supervisor who's like my senior. Do you mind like clarifying that a little bit?
yes,
This is
yes,
almost like the same setting in almost all hospitals, but
yes,
I figure
definitely.
out, yeah, go ahead.
Yeah. So I'll be happy to do that. So the thing is that as an intern, someone is responsible for you. That's why I said we're not expecting you to know everything. And I said just one advice amongst many, be responsible, be teachable, be humble. So you come in, like if you organize, you already know that you're going to preview your charts. You're going to have, be it a note, be it a card, be it your iPad, whichever works for you. You have the list of your patient. You have what the patient came in for, what the patient need, what you need to follow up with. Once you have that, you preview. So a senior is that person that is responsible for you, who's supposed to supervise you. And a senior is usually a PGY2 or a PGY3. So as an intern, You are not a senior to anybody. Okay. But when you become PGY2, you become a senior to the new intern. Then PGY3 is also a senior. So as you get to your PGY2, you will have people under you that you are supposed to supervise. So why am I saying this? They are supposed to help you. This where humility comes. It has nothing to do with age. Some of us are old, and our senior we're like 10 years older than our senior. So it has nothing to do with age. You know what you came for. You want to be a better doctor. You've practiced in Nigeria, you were a surgeon in Nigeria, it doesn't matter. You understand? This is a new system, and you need to survive in this system. So you just humble yourself. If you come, you see the small boy, the small lady is your senior. Yes, that's your senior. You go see your patient. After you see your patient, just like you know the history, the examination, finding, what is expected, you come back. As you've seen, you go to your senior. Oh, Dr. Kobe, I've seen the patient. Can I briefly talk to you about the patient? Then you start talking about the patient. Oh, the patient, this was the patient that was admitted, blah, 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 blah. We are expecting this. Then your senior will have some insight and say, okay, they will correct you, they will correct you, gets you prepared for the attendance round. Then when the attending come, after you've discussed with your senior, now you will miss some things. Definitely you're going to miss some things because it's your first time, your first week, your first month. You will miss something, and your senior is going to tell you, okay, have you checked the potassium? Yeah, the potassium is really low. Have you corrected it? And you fix all those things. Then your attending come and you present so excellently. And your attending, oh, did you see the potassium? Did you correct it? Then you're up for a good start. So that's what a senior does.
Right. There's something I want to say, especially in that scenario, because many of you will be working with Caucasians, people from other races. It's also very important to understand the culture of the people that you're going to work with. One phrase I usually use is, tell me how you want your workflow to be like. Because some people want you to review charts before you go see the patient. Some other people want you to go see the patient before you review charts. And you want to do it in another way, probably review chart at home and then master it and then come back and see the patient. But there's someone supervising you who wants some things to be done in a certain way, unique to him. Maybe not the right way, maybe not the wrong way, whatever, but it's just that's the way I want to work. And what usually causes problem is when you want to insist on your own way and he's already been there for 2 years or 3 years and he's telling you this is how I actually want you to do this. You'd be like, well, why would I do it like that? Why? And then that's where many of us, especially people who are of different origin or different race and tribe, get into conflicts with these people who have different cultural variations from us. So we're taking this time to, highlight some of these cultural diversities and cultural sensitivities in residency so that you can be aware of it, right? There's some people who don't want you to say good morning to them. It's okay. They don't want you to say good morning to them. They just want you to say, hi, what's up? Right? There's some people who want you to call them by their first name. Those little nuances. Make sure you ask somebody, how do you want to be called? Don't just assume the person wants to be called Cynthia. Like I call Oswald, right? But that's not normal for some other people. They don't want you to call them by their first name. Some people don't want you to just call them Oswald like that. I just say, just call me Ed. Some other people want you to say Dr. Oswald, especially women. They are very sensitive. They want you to call them doctor, whatever their last name. They don't want you to call them Cynthia, right? Until the person tells you, call me Cynthia. That way you don't say, okay, hey, hi, Cynthia, right? Because these are cultural, variations that happen in so many places. So make sure you clarify this and how do you want to be addressed? Very simple. Some people, like we know, people don't want to be called him, her, she, is, and all those. And it happens in workplace, right? Some say, don't call me him, don't call me her, don't call me, just say it. Respect the person's cultural or whatever sensitivity, and work like that. At the end of the day, you all try to make a happy room. Everybody's going to be in one common room where everybody stays for the next 3 years, trying to figure it out from there. Yeah, I see your hand, Dr. Solomon.
Yeah, thank you very much for giving me the opportunity to ask some questions. I'm an family medicine applicant, and I've not yet attempted the marching, but I'm a little bit curious. This EMR that we like keep talking about, is there a possibility of having like a recorded session with time on how to navigate your way with the EMR when we start the residency program? That's the first question I have. Then the second question is, um, how much volume are we expecting to have per resident? I mean, how many patients are we supposed to like go through before the round starts properly, like averagely in a day? Thank you.
Those are some good questions, Dr.
Man,
Oscar, over to you.
yeah, that's a very wonderful question. And obviously, this seems like a very smart guy. So he's already thinking ahead, That's a very smart question. The EMRO, Dr. Solomon, don't think it too much. There are a lot of EMRO, a lot. Okay. So in my residency, by this time next year, I'm going to be rounding up. So that doesn't mean I've used all the EMR. Okay. So you are not expected to know all the EMR. So, but I should think that in your bid of trying to get everything squared out, your steps, you'll be doing observership. So in your observership, you get in contact with some EMRO. EMRO, you get used to it. I know, especially for those of us that are coming from Nigeria, outside this country, where we don't really use a lot of electronic medical record, so it may be a bit tricky. But remember, we are doctors, we are smart people. We adapt really fast, so don't worry about that. So, and you would be used to one EMR. You go to a different rotation, it's a different EMR. You just have to learn it. You have to just learn it. Okay, the HPI icons, this is how you open the feed of the HPI, where you put the HPI. In this EMR, you have to click submit before signing. It's just all those little differences, but it's basically the principle is the same. You know, it's you open an EMR, you just note where do you go? You see the HPI. After the HPI, you see the review of system. Some review of system, you have to type it in. Some you just need to click and click and click and click. Okay, walk through the review of system. After the review of system, it's the same principle of writing a note. So if you're in an EMR, you don't see the review of system, know that that note is not complete. So your review of system, then you go to your examination. After your examination, you go to, in some EMR, you go to your assessment, then you go to your plan. Then your plan. What are you going to do for the patient? Then you still have a feed where you order labs. You have a feed where you order imaging. So you get used to it. During your observership, for you that is still trying to apply, during your observership, you get in contact with some of this EMRO. You as an intern, I'm sure you've already seen some EMRO, and that's why you should set up a day to go in and see how the EMRO works in your hospital. I hope that answers the question.
Yeah,
Then,
and then I think during this time they do what they call onboarding. They have to train you people. But for
yeah,
those who have never seen it, probably he cannot even figure it out. See it as a little software.
yeah,
Just like Facebook. You log into your Facebook, put your username and password, you log in, you see an interface, and there are various places that you click that will do different functions. That's it.
yeah,
Just keep it
yeah,
very simple. No
yeah,
matter the EMR, that's how they are all.
yeah.
Just like Zoom. I click here, I'm clicking this, I'm clicking that, I'm clicking this. They're all self-description.
Yeah. So, Dr. Solomon, don't think about it too much. And also know that just as every human being, we're all the same all over the world. I know they used to say that, okay, this set of human being are different from this set of human being we're all the same. It's the same. We're all the same. So, your first day of using an EMRO, you may be slow. Second day, you'll be faster. Third day, you'll be faster. Before you know it, you're a pro. So talking about the volume of patients, for those coming into family medicine, technically, you don't have a cap. And what is a cap? As an intern, you don't have a cap technically. Like how many patients you are required to see in a day, there's no cap. But family medicine, internal medicine does have a cap. Depending on the hospital, they could see, oh, as an intern, you can only see 8 patients in a day. As an intern, you can see only 10 patients. But basically, give or take, as an intern, 10 patients. So even in that system, you don't have a cap. You still, technically, on written rule, you have a cap. Why? Why do you have a cap? No one is going to throw like 20 patients at you. Like for me as a PGY2, I should be able to see 20 patients, no shaking. Like inpatient, see manage 20 patients. Because as an attending, you should be able to see like 25 patients in a day, even more. So you have a cap to the amount of patients you should see. Why? For the patient safety, so that you can effectively, efficiently manage this patient without putting this patient at risk. You understand? We do understand we're all human beings. It will be difficult for you to manage 20 patients, especially when you are still trying to learn. Remember, we think that residency is, oh, we are just going to come in, just be very so fly, they'll just be asking all the questions, I'll just be giving the answers, I'll just be a super resident. No, in the same process, you're going to learn how you're going to learn new disease processes, how to manage disease condition. You're also going to be learning good communication skills, how to communicate with the patient, how to communicate with their relative, how to communicate with your peers, how to communicate with your attending, and how to communicate with the nurses, and how to play the politics in the good politics in the hospital system. So the volume, it varies, but just know that no one will give you patient load that you cannot handle. And you are expected to, the load of volume of patient you should see will continue to increase as you move further in your training. I
Thank you
hope that
so
answers
much.
the question.
Yes. While we're still on that training thing, let's go into deep academics. Were there resources that helped you get better? What are those resources that a typical PGY1 new intern should, plan to get?
Okay,
For
so
family medicine, I know it varies for,
yeah,
pediatrics, internal medicine,
yeah,
but by and large, they're almost the same.
the same. So I'll say this. Permit me, so I may be limited in the resources I may be able to give you. My program is family medicine. So, yeah, there are resources that you should use. One very good one is an intern that I used, which really helped me, not just academically, but also navigating the day-to-day activity of being a good intern. I think there's a book from this doctor who online made it. He has a book, uh, new intern guide. So that book, it's a very short book. I think I have it here. Let me see. So online made it, intern guide, crushing intern year, Dustin Williams, MD. So if you get the book, kind of just go through it to kind of help you. That's a good resources on way of surviving the intern year and how you can get yourself organized. Then other materials, even as a family medicine resident, we have the AFP, articles that we get every month. Whenever you have the time, you go through those articles, go through their topics. There are topics that comes in every month on disease condition. So I used it a lot. It really helped me. Then I also have the habit of checking up things, you know.
He checks up things all the time.
Yeah, so the thing is, people think that, oh, you just sit down. This is not step one. You don't have 6 hours to sit down and be studying. You study as you go. You understand? You see a disease process you don't remember. You check this out. And thank God, things are better now that you don't need to read through a complete article to see the answers to what you're looking for. There are AI, there's what we call open evidence. Yeah. If you've never seen it, it's fantastic. So you just put in, you communicate with open evidence like you can communicate with an attending. You type in what you want, and the answer you are looking for is out. And these are evidence-based. This is not this is not chat GPT. These are evidence-based, articles, links on how they arrive at the answers they are being given. So that helped me. AFP, then ABFM, ABFM also helped me. Then up to date, up to date also help me. Those are good resources. Amboss also, you know. So yeah, so as you go down the road, maybe your PGY2, you could get the U word for family medicine, where you go through question, it has question bank. But the good thing about that is that you have explanation to those questions, so you learn better. You become a better physician. Yeah. So I would say that book, Online Medit, Intern Guide, you can start with that. Then for family medicine, as soon as you can get your hands on signing up with the ABFM, also the AFP will help you. Yeah.
What's a little bit from academics too? Were there times, so like let's say adaptation, social work, somebody put in U word, amboss,
Yeah.
and
So can
then
I quickly answer that question?
yeah, go ahead.
So I won't say either is better, okay? But I will say my preference. At least I'm allowed to have a preference.
Right.
Okay, so my preference is U word. That's the only way I can answer it. My preference is U word. And this is because I get good detailed explanation. So even a question that I get wrong, I get a detailed explanation for why I got it wrong. You understand? So yeah, it just drive home more concept, on why you should, let's say it's talking about disease process, why this medication is better for this. So you see, improve your patient management. Yeah. So U word is my preference.
Thank you so much. For those joining us, this is Global Research Initiative. In Global Research Initiative, we're a community of physicians. We're well over 1,000 or close to 1,000 who come together to hold our hands to support ourselves, either in the journey of residency or getting into residency or on the journey to fellowship. Our main aim is to do clinical research, but along the line, we started, trying to see how we can encourage ourselves to become better physicians in the US, to be able to serve our populations better. We have a speaker today, Dr. Oswald Ugo, who I call my big brother, who is giving us talk on how to become a good resident. We're going to quickly, after a few questions now, pivot into talking about, is there hope for people who want to get into residency? But before we talk about that, let's talk about other aspects of residency apart from the core academics, the socials, the burnouts, the feedbacks, the criticisms, the times where you let yourself down, brain blocks, those things that happen. How would you recommend or advise these new coming ones or these young ones? I call them young ones not because they are young in age, but they are young in the process. To adapt. Let's start from feedbacks.
Okay. So, but can I quickly
Sure,
answer this
sure,
question?
absolutely.
Yeah. Uh, Someone said, what other question bank do we have, right? So remember, for family medicine, I talked about AFP, right? So AFP it has articles, it has uh, they talk about diseases and their management, but you also have a question bank. So for family medicine, that's a good question. Other than even the U word, you need to know that you need to go through those question bank. So that will help you in your boards. So then the ABFM also has question bank, and they send these annual questions. About 30 of them, used to be 25, but now it's 30. So they have question bank. They also have what they call this KSA. So and I do them, especially like for me, I do them when I'm doing a rotation. Like when I was doing my psychiatric rotation, There are
Okay.
about like 60 questions.
Right.
So I take the opportunity to do those questions when I'm doing that rotation. Then when you're going on round, so you appear very smart and they're asking all these questions, they are just providing the answers.
Right.
So when I did cardio, I went through the uh,
Cardio. Yes.
cardio KSA.
Right.
You go through pediatric KSA. So there are resources. There are resources.
Right.
There are resources. So I don't know if that answers the questions. So, but the major one is AMBOs, UWard, uh,
AFP.
AFP, ABFM. You know, yeah.
Now, that's for those in family medicine. We're going to also
Mhm.
bring somebody in internal medicine. I think next week,
Yeah,
Dr. Tobe Chukwuokobi is coming to talk for
yeah,
internal medicine folks. Yeah.
yeah.
So we're quickly moving on to the other aspects of residency that also, determine whether you're going to be successful or not. Burnout, how you handle feedbacks, how you handle criticisms, because these things are going to come. You're working with humans. People are going to say, I'll use the word, stuffs about you. People are going to throw words at you. People are going to, tell you things. How would you recommend? Let's start from the most common one, feedback from your program director, feedback from your seniors, criticisms, or call it whatever you want to call it.
Okay, so I will talk about feedback. As a resident, as an intern, you have to have develop your emotion, like what I call emotional intelligence. You have to have your emotion intact. You need to be able to receive criticism, whether good or bad, you know, and be very professional. So, like I used to say, if someone correct me or say something negative about me, especially in the workspace, it doesn't matter. I ask myself one single question. Will this criticism make me better? If it's going to make me better, then I let it go. I don't pick offense. In fact, you shouldn't pick offense. So everything they say about you should make you better. You understand? You should develop yourself to that state emotionally. Don't let anything get to you. Because the truth be said, whatever criticism that you are being given is because they want you to be better. They want you to be better. So you should be able to receive criticism. Every feedback should make you a better doctor.
Right.
If you kind of rationalize it, okay, what this person said, is it true? If it's true, you can work on it.
Right. I know
If
it's so
this,
easy to say in interview, how do you handle feedbacks? And people just say, hey, I see
yes,
feedback as a way to,
yeah,
improve and
yeah,
grow
but
and make changes. But in the real
exactly,
life,
yeah,
sometimes it can hurt.
it's going to get so real.
Yeah.
It's getting so real when you start seeing patients. So if somebody say, "Oh, your presentation is not," I've once been told by my attending. He looked at me. He said, "Oswald." I said, "Yes, sir." He said, "You were off today." I remember I told you that attending. He said you were off today. You know, yeah, because we're humans, we're not perfect. So then I said, okay, you know what? Let me fix this. So you fix it, because what people want to see is your growth.
Right.
You can't come in and say, I'm a superstar, I know everything. There's no one that comes in and knows everything. There's always something to learn. So once you get the feedback, that's why I said emotional intelligence. You need to check your emotions. You understand? You are here for business. This is real life.
Right.
When you come in there, just no, it's not nothing personal.
Okay.
If they give you feedback, take it, run with it, fix whatever you need to fix. And they will also tell you. Some people will tell you later and say, oh man, you've really improved. Good job.
Right.
Yeah.
Pivoting away from feedback, is there a role for social support, family, friends?
Yes.
Because it can also make or mar you.
Yeah. So first year is tough. I won't lie to you, it's tough. But it gets better. There's a light at the end of the tunnel. So especially when you know it's going to get better. So you can be able to take whatever comes your ways. So you need emotional support, you need family support. You should also when you come into the program, it's not a competition. You should build alliances, you know. You have
100%.
friends. You have people who become your tribe. It doesn't have anything to do with where you're from, or if the person is an African, is the person a Caucasian. No, it doesn't have anything. Your tribe can be people from every other part of the world. So you will see people who think like you. You see people who reason like you. You see people who do not agree with you, but you need to be professional. So you still need to be a good team player. You understand?
Right.
Because that's one thing you learn in residency.
Right.
You
Build alliances.
you
Talking of
build
build
alliance.
alliances, is there a role for mentorship? I
Yeah.
know some programs have formal mentorship where they assign and some other programs, but I also recommend people look for one or two people who they think they can confide in,
Yeah.
and
So
make them mentors.
like most program, they will give you a mentor, PGY2, PGY3, somebody you can confide in, somebody you can talk to, somebody who's going to help you, show you how to navigate the system. They will always provide that for you. But it doesn't mean that somebody was assigned to you should be the person you should make your tribe or the person who will eventually become your mentor. As you go in life, people have gone before you. You understand? People have gone before you. Whatever you're going through, there are people that have been through that same situation. So they have words of wisdom to be able to give to you to make you better. So you will look for people, you will see them. Be in the lookout. You see people whom you think you can ask questions. If you keep asking them questions, you keep asking them questions, they will know that, okay, automatically they become your
All right,
mentor
this person wants to learn.
and we help you. So,
Right.
and you also form alliance with your co-intern. You see some residents, it's not a competition. You see some residents that are better than you in some aspect. There are some people better than me in presentation. There are some people better than me in academics. There are some people better than you in being able to communicate with patients. So the essence of coming into a program is to learn from this one, learn from that one. So your ability to say, okay, this person have something I don't. How do I learn from this person? And when you form
Absolutely.
alliance, it becomes a better
Absolutely. We are almost out of
experience.
time. For an intern who or a prospective intern who's scared, what will be your last words for the person?
So I think my last word for people that are, hoping to get into residence is be persistent, consistency. You understand? Improve on yourself. Every program wants to see that you're improving on yourself. Can I quickly just share one experience?
Sure, absolutely.
I remember one program that I interviewed, and program will tell you, okay, you're a good fit, we'll see what we can do. And I wasn't matched into that program. But guess what? I went all in and I improved on myself. The second time, they sent me an interview again. The second time, they were practically begging me to make sure I choose them first. Why? Because they saw that I improved on myself. The program director actually told me that you are now a very desirable resident. So continue to improve on yourself and you eventually match, you
On
know.
that note, continue to improve yourself. We're going to open it up for questions. Anybody can unmute your mic and then you ask your question. We're not going to keep him that much because I know he's busy. Tomorrow is work day. After he's done with his talk, we're going to have the another session, like 10 minutes for those who want to march into residency. There's an exercise that we want to do for them because I was talking to a lot of people. We need to like begin to stimulate these people who want to apply this year to do something every Sunday, get a checklist, do something. We'll talk about what you've done and how you can improve, especially whether you're matching here or you're matching in Canada. So questions. If you have any questions, you can unmute your mic. If you don't have any questions, we're probably going to take the final words from Dr. Oswald. Dr. Oswald Ubo, I'm very grateful. What a short notice I gave him, and he said, "Sure, I'm going to clear my schedule." and be here and give us this talk. Any questions? Again, like I usually say, after a talk, if you don't ask questions, it's an opportunity to, connect to him, connect to other people, let people hear your voice. It's a community. Nobody's judging anybody. No question is useless. So, yes, Dr. Roots, go ahead.
Thank you, Dr. Ugo, for the presentation. My question is this: you mentioned improve yourself. So could you give us one or two practical ways that we can improve ourselves? And my second question is, if you were to look back as a PGY1, what one advice would you give your PGY1 self if you were to do that? Thank you.
All right. So, excellent question. Improve on yourself. What do I mean, improve on yourself? Yeah. So you applied this year, right? And you didn't match. Don't use the same resume that you used this year to apply and use it for next year. Without nothing changed. What that means is that you are not growing and you are not allowed to be stagnant. You have to grow. So take, for instance, you applied this year and you did not do any other observership before the next application season. Man, you're doing yourself injustice.
Right.
So you need to go out, make more contacts, do another observership. Research. You had only one research. You don't have another research. You don't have two. That means you've not been doing anything. Maybe you were doing a particular job. And I remember one program director asked me, he said, "You've been doing this. How does it help you?" After you have interviewed and you did not match, your duty is to write an email to all those program directors. Write an email to them and ask them, "Thank you very much for inviting me. Is there a way I can improve on myself to become a very desirable resident or an
The next
applicant in the
application,
next
right.
cycle?" They will tell you. One program director called me and he told me, and you will run with those things they told you, you will work on them. That's how you improve on yourself. I don't know if that answered the question.
Yeah, absolutely. And you're talking about improving on yourself as an intern. If you present today, go back home and read about what you presented. You'll see that next time when you are presenting, let's say you presented the case of pneumonia today, make sure that when you get home, before you sleep, look up pneumonia, look up the guidelines, look up one aspect of it, even if it's how to examine the lungs, even if it's what other tests would I have written, because you miss something. What am I missing in this workup? What would I have asked in the history? What would I have asked what would I have checked in the physical? And then, oh wow, do you know, I missed the cough duration. Okay. And that way, next time you add cough duration. The next one you add characteristics of cough. The next one you add history of contact. The next one you add history of immunization. The next one you ask, and you keep adding and keep building.
Yeah.
Every day you see a case, do not sleep without reviewing that case. You may not review all the 5 cases you saw, but just pick one and read about it. Next time you get better and better and better and better. On that note, Dr. Oswald, thank you so much. I don't intend to keep you beyond now, except somebody else has something to ask. If you do, yeah.
And for Ruth, there's the second question. She said, "What would I have told myself?" I would tell myself, relax. No one expected to know everything. Just come, show up, be responsible, be humble, willing to learn. That's all.
Show up, be responsible, be humble, and willing to learn. Dr. Oswald, thank you so much. We've gone way beyond the time we discussed 8:11. Thank
Welcome.
you so much, and we look forward to more engagements with you. And for those who want to, share or maybe say one or two things, Oswald is in our group. you can reach out, say, Dr. Also, thank you for your, conversation today. May I reach out to you? I don't usually share people's
Definitely.
contact, but if he sees your message and he wants to reach out to you, he's going to respond to you privately.
Anyone can reach out to me. Anyone can reach out to me. At
Absolutely.
least if you're a doctor, you can reach out to me. Just kidding. Anyone can reach out to me.
Thank you so much,
Definitely.
Dr. Russell.
Definitely.
And we're going
Anytime.
to thank you so much. Again, this is IMG Research Academy. We've had a talk today on how to survive. We've invariably covered the 6 ACGME core competencies because there's something they call 6 core competencies that you're expected to have or to know when you get or to be when during your residency. We've discussed them in a very informal, very relaxed way. Those 6 core competencies are patient care, medical knowledge, professionalism, practice-based learning, interpersonal communication skills. What else am I missing about that? I think these are the 6 core competencies, and we've talked about them in one way. I think the only aspect that we left out a little bit is patient care, but we'll talk about patient care somehow directly or indirectly. We'll continue this conversation because of time. We're going to end it here. Today, my name is Dr. Okobi. Thank you for being with us. I'm going to stop this recording now.